So welcome to this session. We're talking about climate data. We're talking about links into policy, and we're talking about how we can overlap climate data with other data sets, health data, socioeconomic data, and what we can learn from other sectors that have also made a leap between into evidence-driven, data-driven policymaking, specifically health, public health. So I have a list of great distinguished experts to join me in a quick round of question and answer. I would love to just go around, and if, as I call you out, please introduce yourself, where you're from, in a kind of one sentence. Alicia, do you want to go first?
All right, can everyone hear me now?
Yes, we can.
All right, it's a pleasure to be here. So hi, everyone. My name is Alicia Karsbeck. I'm so pleased to be joining this panel. Let me just give you a really brief background about myself and how I got here. I'm actually located here in Boulder, Colorado, in the United States. I spent my career as an academic at the National Center for Atmospheric Research as a climate modeler and climate scientist. But I've spent the last 6 years in a combination of private sector roles in climate analytics, and then also in roles and directing programs at nonprofits that are aimed at sort of trying to increase sort of equity in terms of the use of climate models and climate data. So I'm here on this panel sort of representing both an academic perspective, a nonprofit sector perspective, and also a commercial sector perspective on the importance of climate information and some issues around that. Thank you.
Thanks, Alicia. You made me realize I didn't introduce myself, which never helps with a moderator. So I'm Daniel Mikhailov. I am a computer scientist and a social scientist of technology by training. I am an executive director of a nonprofit called data.org, and we help use of data and data-driven technologies for nonprofit purposes, particularly in health data, climate data, and financial inclusion sectors as well. So that's me. Let me continue going around with my co-panelists. Zulma, do you want to go next?
Hi, everyone. I am Zulma Kukunuba. I am a medical doctor by training, then became infectious disease epidemiologist. I'm a researcher here at the Universidad Javeriana in Bogota. I have worked for a number of years on understanding disease spreading across different types of population, and particularly focus in Latin America, and intervention control strategies to prevent or mitigate the impact of epidemics. So that's me. It's a pleasure to be here.
Thank you so much, Zulma. Rumi, do you want to go next?
Sure. Hello, everyone. And yeah, it's a pleasure to be here with the audience and also my distinguished co-panelists. Thank you so much for hosting me. So I'm based here in New York at New York University. I'm an associate professor of biostatistics and computer science, and I direct the Center for Health Data Science. And while also researching best practices in the use of data for public health modeling, we including planetary and human health, we also have extensive efforts to help build the academic community worldwide to support these efforts. So look forward to chatting more.
Thank you, Rumi. Chris, do you want to round us off, please?
Yeah, sure. Hi, everyone. My name is Chris Leonard. I work at the Climate System Analysis Group at the University of Cape Town, and I'll switch my phone off. Similar to Alicia, I'm a climate modeler, so I grew up running climate models. Actually, I grew up a biologist. I moved being somewhere a conservation biologist into the climate context. So why I'm at a health discussion, I have no idea. Yeah, and I'm very interested in the regional expression of climate change. So if we say the world heats by 1.5 or 2 degrees, that's a rather political number. What does it actually mean for me in Cape Town or for someone in Bogota? So the regional expression of climate change and what the impacts of that regional expression is, those are my interests. And health is one of the things that we're involved in 3 projects that have to do with health impacts. So this is where I am.
Great, thank you, Chris. And you've nicely set up a provocation for us, because what you're doing in questions about health, hopefully we'll be able to better answer at the end of this panel, because the whole thrust of the panel is how the different disciplines of climate data, of health data, policy making, computer science, of course, overlap and interact with each other. So we'll see whether we can answer this question better at the end. But it's great to have all the panelists here. In terms of conflict of interest, just note that I am working collaboratively with all of the panelists in a number of different programs, from Epiverse in infectious disease to Climateverse in climate data. And I'm also on the expert advisory panel of the CAFE team. So that is just by way of noting. Let's get into the discussion then. So Rumi, my first question is for you. What is the importance of local data in addressing the climate crisis? And what are some of the challenges to using this data to drive action? Please kick us off.
Yeah, thanks, Danielle. Of course, the data question is kind of the skeleton of any kind of modeling efforts that we build, et cetera. And I like how Chris nicely put the idea of a regional expression of climate models. And so what are the appropriate spatial granularities, temporal granularities specific to a location will dictate, of course, the need for local data. And my experience also being a lot on the health side will also mention that, you know, health data is somewhat has an added layer of challenge being related to people and added complexities of privacy and security that could be also local in their nature in terms of regulation, culture, et cetera. And so the priority of local data is, you know, of course, maybe is clear in terms of the relevance of both of these types of models. But having that local input as well is important to shape what's feasible in models and what's normalized or preferred by populations. So challenges, then onto your Danielle's question about challenges, you know, data is more plentiful these days. We've seen that throughout different sectors. Yet at the same time, you know, we always have challenges with populations that are marginalized, places that are marginalized, and those challenges also percolate down into the idea of data resources from these locations as well. So that's going to be a big challenge if we're interested in the local expression. And so I'll say a few more words before we'll talk about ideas around that, but the challenges are not just in the data resources, but having the right people to identify and procure those data, and also from those who aren't working on the data side, the lay public, to have an understanding of what it means for data to be created, used in their local places. So there's a lot of layers of information and education around the data question.
Thanks so much, Rumi. The way I like to run these panels, I know all of us have been on many of them over the years, is a bit more interactive. So feel free, any of my co-panelists, if you want to jump in on anything that Rumi said and follow up, we'll make time for it. So just before I go to the next question, anyone who wants to come in on those points? Okay, good. I will do it myself then. One of the things I think we'll talk about later in the set of questions, Rumi, is about capacity building specifically. And one of the key lessons for me in working in the data domain for the past 20 years or so is the importance of understanding what questions to ask. And directly relevant to what questions to ask is who is asking the questions. So that gets us straight away to the diversity of the askers of the questions in the team. So I think there's a great relevance there. Localism needs to be grounded in diversity of opinion and viewpoints in all sorts of ways, from gender to race to cultural background and also discipline. So domain expertise in different disciplines. We'll pick this up as we talk, I'm sure. But let me move on and ask Alicia you the next question. what are some of the computing and infrastructural barriers many data practitioners and climate scientists faced, especially in low and middle income countries?
Yeah, thanks for that question. It's actually a really important question. I think it's sometimes an area that people tend to have a blind spot around in terms of the computational and the infrastructure needs that are required in order to really generate important climate information and also make use of it. So, Chris, I think is going to talk a bit more about this concept of the local expression of climate data, which is very important for the health question. What I want to point out to the group is that when we think about climate data, there's a number of different pieces of that. So of course we think about things like observational data, and people have a tendency to sort of move towards that. Also social data, health data. When in the climate field, a lot of the data that we actually analyze and use to understand impacts is model generated data. So this is data that is either sometimes generated on a global scale through global climate models. Sometimes it's weather data that's generated at regional or national meteorological services. And sometimes it's data that is created as part of a downscaling process where we take coarse resolution, global scale climate data, and we actually downscale it into the more local resolution. All of those processes are based on very, very expensive geophysical models of the atmosphere, the ocean. And there is a lot of overhead in terms of computation in order to run those models, and a lot of overhead in terms of capacity building in order to have the disciplinary expertise to understand how to run those models appropriately. So, here in the US, where we are very, very well resourced, in terms of our ability to have high performance computing to answer some of these problems, we still face really actually quite a lot of challenges in terms of having appropriate workforces to work on this problem and sufficient high performance computing capacity. When you're talking then about low and middle income countries, ones which arguably are likely to face some of the biggest impacts in terms of climate impacts, these problems are deeply compounded. So there are problems with access to appropriate high performance computing in order to run these models. There's a lot of issues in terms of having the internet bandwidth to actually download some of this data to local computing. There's issues around actually having sort of the resilience in terms of, even if there is local capacity, keeping the machines that are available actually up to date and well maintained. So these are actually huge issues in terms of the ability to really appropriately use climate information and make it very relevant. So I just wanted to sort of mention a couple of those here in order to sort of open up that conversation that when we think about these really technical issues around computing and infrastructure, they really do present serious barriers for folks in low and middle income countries.
Thanks very much, Alicia. Datadog runs many programs around the world, and one of the first ways we plan our intervention in the space is very much looking at the local ecosystem, the digital divide, which is very real and affects places significantly in how they're able to do work. However, having said that, many of our programs do amazing results with the infrastructure that they have. I would love maybe Zul or Chris from the City of Columbia, South Africa. Do you want to add anything on this topic of infrastructure and how to deal with the realities of the digital divide?
Yeah, perhaps I can mention a couple of things. So the big challenge here in Latin America, and I think it may be common to other low and middle income settings, is the fact that because of the type of data sets we need to answer questions in terms of the impact that climate may have on health are coming from so different sources. A big challenge currently is coordination between these different sectors who actually collect the data, with the logistics and the logic behind the data collection for each of these sectors, from financing ministers, ministers of health, but as well the climate data, all comes in different forms and shapes. They are not speaking exactly the same language. So for them to work, there is a lot of efforts in terms as well of coordination, governance, and as well legal issues in terms of who is the owner of this type of data, who make the decisions on how to share the data. So I'll leave it there for now, but I think coordination makes a big challenge in this.
Thank you so much, Ilma. Chris, moving directly, we mentioned, Alicia mentioned capacity building, we mentioned it in Rumi's answer as well. So the question is directly relevant to this. So data and tools are only useful if we have the capacity to adopt and implement them. So tell us a little bit about your work in training a multidisciplinary climate science community through the Climate System Analysis Group that you have at the University of Cape Town.
Okay, that's a nice question. Thanks, Daniel. One of the things we started, let me go backwards. There's a global program in climate called CORDEX, which stands for the Coordinated Regional Downscaling Experiment. And CORDEX is trying to downscale, which is if you have data coming out of a global climate model, the global climate model gives you an answer for rainfall or for temperature, say every 200 kilometers. So it usually is a cube that's 200 kilometers by 200 kilometers, and you get one number for rainfall and one number for temperature every 6 hours. And that's what a global climate model does. What a regional climate model tries to do is downscale that to a particular region to, say, 20 kilometers or 10 kilometers or 50 kilometers. And what CORDEX, the Coordinated Regional Downscaling Experiment, is trying to do is do that downscaling. So go from the very coarse scale global resolution, so the 200 kilometers, to something a lot finer, like 20 kilometers. And in doing that, it's doing what Alicia was saying. They uses lots of computer power, which we generally in Africa don't have. So it gets done in Europe for us, and we get the data from our European colleagues. And in the capacity development component of that is we have then, over the last 10 or 12 years, built up a very competent African climate community who analyze this climate data. So both climate scientists who will try and think about what does it mean for rainfall, temperature, extreme rainfall, extreme temperatures, and those types of things. But then also impact scientists. So for example, malaria modelers or hydrology modelers, energy. I'm very into energy, so renewable energy modeling. And just building the capacity within Africa for building African scientists who can address these different types of questions. So if you're a climate scientist, you want to know what's happening to the West African monsoon in 2050, because it's going to impact agriculture and society and health in a number of different ways. So we have the climate community doing that. Then we have the malaria modeling community are working with the climate community to think about how does this then affect malaria in that West African region. Similarly, hydrology, how does it affect water security in Cameroon, for example, in the Benue River Basin. So we've built this very large network of African climate scientists and impact scientists who are now they're publishing in papers that Westerners publish in, if I can say that. So that's part of the capacity development that we at CSAG and at CORDEX have started to develop. And we have one guy in particular who is the malaria modeler, since this does have a health focus. And we've published 3 papers together on malaria in West Africa and what malaria might do in those countries. The other part of the capacity building is it helps us as climate scientists understand malaria data, for example. And it helps us understand hydrology data as climate scientists. And then we can then take the health practitioner through the various nuances of climate data. This is what you can do with it. This is what you shouldn't do with it. This is what you absolutely must not do with it. So it's always a two-way process. We're learning from our colleagues, and our colleagues are learning from us. And we see that that's the model. That's how capacity development should be. If you're not being built, your own capacity is not being built, then you're doing something wrong. So yeah, thanks, Daniel.
Thanks, Chris. And that mirrors so much what Zuma said about translation between different disciplines. So I think there's a definite lesson there about how we train scientists and mutually train. So it's a dialogue. One discipline trains the other, and vice versa, in creating those connective tissues, understanding the languages between, not just in the discipline. Alicia, I can see you want to come in. Do you want to?
Yeah, I do want to mention another point about this. So I'm assuming that many people on the call are actually coming from the public health perspective, not the climate perspective. So I wanted to just mention something about the ecosystem kind of climate research a bit, which is that people learn to do climate research. It's very much an apprenticeship model, and not unlike what you probably are seeing in health as well, which is effectively there are in order to become a disciplinary expert, you have to go through many years of training. Usually that training happens through a PhD program or a master's program. And it's usually a program that is, in some way, shape, or form through an academic institution, and then you are sort of mentored by other people. There are no quick and dirty courses on doing climate modeling well, right? Same as with health. And so when we think about capacity building, it's important to remember that these are multi-year processes that take a deep amount of investment by I would say someone who's in a mentorship or a professorial role to bring people kind of up to speed in using that. So I think it's just important to keep in mind that when Chris talks about the programs that he's doing, and this is true here in the US as well, it's just there's so much investment from a person time in terms of bringing up kind of the next generation of people into this space.
Yeah, so we're not talking about a 1 month course here. We're talking about a multi-year investment. I think that's a really good point, Alicia. Thank you for bringing that up. So we talked so far in the first kind of section of our conversation about grounding in the kind of the reality of the climate data, how it overlaps with health data, infrastructure, capacity building. But of course, our talk has a second part to it, which is policymaking. So let's move a little bit more into how we use this data for decision making, how we help policymakers with the data they need to make evidence-based decisions. Zuma, I'll go to you first. What lessons do we have from the way public health, infrastructure, governance, relationships with policymakers have been set up that we think we can apply to climate data? Because in the health world, we have a long-established structures where we have ministries of health, we have public institutes of health in many countries, we have international organizations, and some of that infrastructure exists in climate, some doesn't. So what can we learn from one to the other?
It's a great question, Daniel, and a very difficult one. I think from the public health sector, there is a lot we can learn from climate researches. But I think in terms of health, one thing that perhaps strikes me a lot in the way we develop the decision-making process is that health is very related to human decisions, in the way that you may use this vaccine, for example, to prevent your disease or to reduce the risk of having a severe disease, or you take this action because it's giving you some options to make decisions to reduce the impact of health. I find it difficult for public health to still understand what is the potential impact, the exact impact on some different diseases from the different climate changes or the different aspects of climate. And it may still need quite a bit of research to understand what is the potential impact. For example, is well understood what is maybe the impact, for example, on viruses, dengue, Zika, chikungunya, but it's not the same level of knowledge for other pathogens. So those aspects makes it, I think, it's still difficult for the public health sector to understand how to link climate data to decisions. So I think we need quite a bit of investment on the right research questions that could be given to decision makers in the public health domain, along with this together understanding of how the data, the models are working. In public health, we may have some more intuition into what type of decisions may we take in health, but still there is a disconnection about the levels of understanding on climate and the impact on health.
Thank you for that. No, the complexity is very real as we're building the plane whilst very much having already left the cliff, so to speak, flying at the same time. Rumi wants to come in.
Sure. Yeah, thanks, Daniel. And just building, I think Zulma's point is really important, and maybe just building a few threads out of that. Absolutely correct in that I think a lot of, it's clear a lot of the impacts of climate on health need to be studied in terms of different disease areas, in terms of different regions. And that needs to be prioritized, to your question, at the policy level in order to put those priorities forward. And I guess I just wanted to also maybe elaborate on some of the differences as I'm seeing them, and I'm happy to hear from our other co-panelists on that as well, where maybe we can, talk about the COVID pandemic being a situation where there was perhaps a very dynamic and over a short time period, decisions had to be made, you can imagine at the local level, about healthcare resources, drug development, and so on, all within the span of, months, if not, tighter time periods. Of course, this is not to diminish the importance of understanding climate effects that have dynamic feedbacks, repercussions, etc. But in some ways, we're in a position where policy can take a point of view that has a little bit more leeway to take those positions, maybe more time and space that way. So that's a real plug for the need for more a good point to be discussing this exact topic. And I think I'll just make one more overall, is that from our experience and working with a lot of colleagues in different places, is that again, even bringing up the capacity point is kind of, and this is true with any policy question, is to show the importance to the policymaker, so they know what to act on. And that can also be like an information or education question. So just a few differences on the health and climate policy sides, and also plugs for attention at this point. Yeah.
Thank you for that follow-up. I think in my experience, policymakers often rightly complain, in my view, at data scientists, data analysts like myself and my teams, that we don't go far enough to understand the constraints they operate in, the political constraints, the policy constraint. Fundamentally, we don't take enough time to learn their language. So we talked a little bit about like learning other languages and translating. We don't take enough time as data experts or domain experts, climate, health, to understand the constraints of the policymaker. That's an interesting additional language we need to all learn, I think, collectively, in order to build those links. I can see Chris and Alicia want to come in. Chris.
Yeah, thanks, Daniel. It drifts nicely off what you've just said. We were involved about 5 or 6 years back on a project called Fractal, which stands for the Future Resilience of African Cities and Lands. And in Fractal, it was designed as a typical who was it? DFID at this time. So it was funded by the UK. And I had 5 work packages. Work packages 1 and 2 had to do with climate, and 3, 4, and 5 were to do with everything else. And we actually turned that on its head. And we spent the first year and a half of that project. We were working in 5 different cities across Southern Africa. And we spent the first year really just connecting with the municipal managers of all of those cities and learning the languages. So we speak climate, they speak policy, someone else speaks health, someone else speaks hydrology. And it was so such a revolutionary experience for all of us, is that's how we now do our projects. We don't start with the climate. We start with the questions. And often the questions are not known. We think we have the question in our head, but when we interrogate, we realize we don't actually have the question in our head. So we spent the first year and a half of that project building relationships within the project and figuring out what the questions were. And then only later did we get to the climate stuff. So we now have that model in a project called Cascade, where again, we've got social scientists on board to help us do this side of things. We've got climate scientists, we've got the health community because it's a heat-related project. And I think beginning with the question and beginning with the relationships, if this is a policy thing and you really want to speak to not get your ideas through to the policy person, but to actually co-explore and co-develop the questions and the solutions to what your questions are. Because then it may end up you don't actually need climate data. It's really you need to do the drainage properly. That's going to solve all of your problems if you do the drainage. You don't need to worry about climate. And if we get to that solution, that's the correct solution. We don't need to drop the pride thing that you must have climate data to do everything, but sometimes you don't. So yeah, it's the relationship and it's getting the questions right together.
That's a great point, Chris. Thank you for making it. It's always a sign of a good panel where we veer off the prepared questions, which we've done, but that's a good thing. Like, let's keep going. I really like the theme we're developing on translation between disciplines. What you just said, the framing of how to deal with policymakers, bring them in early into the process and ask questions, which may mean you don't do what you thought. Your research might not go in the actually thought it might, which is a good thing. Alicia, over to you.
Yeah, perfect. I want to just continue drawing on Chris's thread there, and give just some examples. Again, this is from the U.S., but this example that really highlights the importance when we think about climate and health, the importance of thinking about different timescales over which we manage that process. So I sit on here in the US, I sit on a panel called the Climate Working Group of NOAA. NOAA's National Oceanographic and Atmospheric Administration. And one of the things that we have been analyzing is some cities in the US have been putting into place heat officers and flooding officers. So these are people whose specific job is to think about what is the collective response in their communities to the increased tendency towards, at least here in the US, towards extreme precipitation and extreme heat. And as Chris points out, like this is basically a question where we may think that extreme heat is a climate question, right? And from a planning perspective, it might be, but it really dovetails intimately with things about the demographics of a city. Sometimes it's about the infrastructure of the city. When we think about heat stress in particular, we know that there are extremely local impacts of heat, that they're more likely to affect areas in a city that don't have a lot of tree cover, et cetera, right? And that when we think about planning, then we need to bring in the people who are thinking about what is the right way to do the city planning to reduce that. But then there's other piece of it, which is about emergency response, right? Emergency response very, very much has to do with maybe bringing in information and relationships, tightening that up with the National Weather Service, right? So the Weather Service in the US, we do not think of that as the same as the Climate Service. But when we think about emergency response, that's actually the right agencies in terms of getting the right information at the 1 week ahead type of time. And then also, of course, bringing in all of the community resources that are needed to actually go out into the community, make sure that people are safe in their homes during extreme heat events, et cetera. And of course, the same is very much true for flooding. So, I want to again then highlight that, even though we use this broad word about climate data, it's really a question of bringing in data that's not only about the public health, but also social, and then of course also even at the weather timescales and that emergency management piece of it.
Great, Alicia. And that probably sets me off a question I wanted to ask Zulma, which is about different data types and how we build interoperability between them. So, Zulma, how can we encourage greater integration between climate and health data analysis? So now we're talking about not just capacity and translation as we discussed, but like at the data pipelines level, at the tools level, how we can make it easier to overlay different data types. For example, can we upskill existing epidemiology roles to act on climate data? Can we look at existing tool sets and extend them to also bring in climate as one of the variables to look at?
Thanks, Daniel. Yeah, I think it's definitely a need, particularly in our countries, to think on programs, academic programs that respond to these needs. Is not an easy way to convey to whether this specific set of skills that may be needed for these types of roles, but definitely we are moving into an area where big data is a huge issue for dealing with questions on climate and health, but as well the right questions, how we link that to decision-making processes in the different countries. So there is a need for setting up more academic programs. That's definitely something of huge importance, but also I think it's important to come as well to ask questions for decision makers in the health sector. What I'm referring to that is, for example, in terms of the type of questions we normally need to do in the health sector is, what are the resources, human resources I may need for this particular crisis? What are the type of vaccines I may need to deploy, for how long, to which age, what are the different options of the decisions I can make? So coming to those types of questions, I think may be easier to build the data sets, the data ecosystem, the data infrastructure that can take us closer to the decisions. And there is much need of projects of this type. I think could be a good way to start connecting the two in a much better way.
Thanks for that. Anyone else on the panel wants to come in on this idea of looking at actually at the data layers, how to bring the different data together? Are there big data sets which are missing that you would love to bring in, for example? That would be an interesting provocation. Rui, please go.
Danielle. Well, I think, yeah, that was, thanks so much, Zulma, that really was a great point. And yeah, to Daniel's provocation, and as Zulma had already been motivating, you know, the time is ripe to bring together these multi-sectoral resources. And Alicia also mentioned this. I think, at least in the US and globally, there's more of a kind of a movement around, you know, social determinants of health, social factors. And so I wanted to highlight some of the challenges with bringing in those types of data. Of course, some of the same ones around linking across sectors will be there, but in particular, and as we already talked about, some of the climate versus health data challenges, health being person related, and having added challenge is that might not be as available from satellite sources or large or kind of sensor-based sources. But once you go further into things that are, and I always use the word distal, I'm not a physician, but, you know, further from the outcomes, so things like social factors that might affect our decision making, our behaviors, and then our outcomes, you know, those are further out from the outcomes. So what those mean in terms of measures can vary dramatically from place to place. They could be cultural norms, they could be social factors like types of discrimination. And so putting those into data, although we're seeing how they are more important for health, they can impact the mitigation of climate challenges, they can affect our resilience and vulnerability to them. Yet, yeah, how do we define them is very challenging, again, for the local expression, and then going further to measuring and, you know, putting those operationally. So I just wanted to highlight those types of data, and yeah, and look forward to hearing others as well.
Thanks so much, Rumi. Alicia, I can see you have a hand. Do you want to come in?
Yeah. A quick note on that. I think obviously the questions of what are the real data layers needed are so specific to the actual public health problem that we're thinking of. So we could have an entire panel focused on a very specific problem and start to try to tease out those different data layers. I want to just follow up on what Rumi is saying, and it's a slight deviation, which is just to point out that this question of the different data structures that are adopted within different communities can be really important, both in terms of allowing it to become easy to bring together data, making it more difficult. And I'll give just a quick example of that. As Rumi pointed out, health data tends to be person-oriented, whereas climate data tends to be location-oriented, right? And so the data structures that we adopt in climate and weather have this feature which they tend to exist on grids. They exist on these grids where we chop up the world into these sort of spatial compartments, and we put an attribute of climate or weather or risk, a hazard risk, kind of at that geographic location. And then the question of how that maps onto a person, right, who moves between these locations, right? Sometimes they're not even in the same region. And as Rumi pointed out, that there are social structures which are sort of unseen in the world, which actually map then across these. So an example might be something like, an area where there is a high level of insurance coverage versus an area where there's a low level of insurance coverage. These are sort of unseen but important factors. I can't speak to the way that the health community is thinking about this problem of what's the right way to have the right technical data structures to allow this mapping. I'll just say a couple notes about this from the climate space. So again, climate modelers and climate scientists, we tend to operate in this concept of these kind of grids that are in space. We do have the benefit of having a whole industry of folks who are called geophysical information systems, so GIS systems, which are kind of intended to start to make a more rational mapping between information that sits on the regular grids versus information that may exist with a little more complexity there. So we sort of have that concept. We have a newer concept that's coming into place that is being driven in the private sector, which is the idea of coming up with data structures that allow folks in the business space to start to more, I would say, just seamlessly bring in information from this location-based climate data into some of the business metrics, right? And there are companies that are popping up who are built around trying to make that process easier because they understand that there's a market from the business perspective and understanding climate risk and bringing that information in. I don't know whether or not in the public health or in the health sphere, maybe this is the question to ask the group, whether or not there are folks who are really thinking about that particular problem and whether there are folks in the private sector who are trying to solve that problem.
Thanks for that, Alicia. Well, it's a perfect segue because I wanted to save the last 10-15 minutes for questions from the rest of you, the audience, and thank you so much for joining this great panel. I have a few questions posted in the chat that I'll read out. So this is for anyone on the panel. Feel free to whoever goes first, go in. Let me pick the first one. So this is a question from Edison Calderon. As Zulma says, I guess Zulma, this is for you, I suspect. Oh, hold on, there's a police guy coming. Give me 1 second. The beauties of being of live transmission. So Zulma, as Zulma said, one of the great challenges for managing climate data to care for human health in countries of the global south is the coordination of different institutions to share information and coordinate joint action. Therefore, what solutions are viable to improve interinstitutional articulation and comprehensively confront the impacts of climate risks on the population? So I guess the gist of the question is, what tools are available for us to help institutions, different ministries, different even sectors? Alicia mentioned private sector, private, public, non-profit, academic. What tools are available to help that translation process? Zulma, I'll go to you first.
Thank you for that question, Edison. I think there's been quite a bit of progress on, for example, building offices of climate within health institutions. So I think that's a big step that started just a few years ago in Latin America, like within the National Institutes of Health, ministries of health, to have offices and dedicated people to think on the impact of climate. It wasn't that way a few years ago. And building that trust and relationship between these different institutions in the same way in climate centers, research center, or institutes for climate, to build offices to think on health. So I think that's a big step, and make them to work together. That's really, really important. On the other hand, from the research side, I think there is various initiatives that have been starting over the last years as well. One of them I would like to highlight is the Harmonize project. It is a project that is coordinated between various countries in Latin America as well in Spain, to build together this idea of how to link these data sets that have been disconnected and prevent people from having an easy way and tools to rapidly, and open source tools to rapidly access the data and deal with these problems of how to connect the data in a much faster way. But I think this is still a lot of effort that need to be done. And I think, and I would like to highlight this, the decisions that need to be made from the different sectors are so different that we need to find a way to connect the decisions. We may spend a lot of time trying to connect the data, but as some of you have highlighted, in the end could be that that is not the data that is needed to make the decisions. So I think we need a better effort to connect it, what are the type of decisions the decision makers face in each of these sectors, to then coming from the decision to come to a more coordinated way of building the data sets and the infrastructure that is needed.
I think that's a great point. So it's one lesson we learned very, very painfully, all of us across the world during the pandemic, in how we tended to work in silos. First, we all looked at the specific disease impacts, the reduction number of COVID. Then suddenly we realized that there are socioeconomic effects on the economy when you go into lockdowns. So we went from health experts, then we went to economists, but we haven't built the bridges between them. So the conversations were in little silos and they were not connected. I think the how to connect the questions and the that are being asked and the disciplines that are asking them, I think is a really good point before we start looking at the data even. So I will take another question before we run out of time. So the question is from Kaushik Sarkar. In countries facing significant climate variability in Southeast Asia and Sub-Saharan Africa, what specific strategies can be employed to bridge the gap between the high-resolution climate data and the development of localized policy action that are both scientifically grounded and culturally sensitive to mitigate adverse health and environmental impacts? Really great question. Any one of you who wants to come in? Rumi, please.
Hi, Danielle. I mean, yeah, that's a great question, Kaushik. I think a lot of the threads that we've spoken about here would be key for that exact question, in that specifically bringing people together across those sectors, climate and health, bringing people from the policy side to the table at the beginning. I know it seems like some of our attendees are also from the policy side, and that would also not just give them input, but also visibility into these types of efforts. And I would add to that, even from our earlier conversation, this in a place-specific way, local way as well. So I know with some of our panelists here, we're trying to get this kind of model off the ground. You can think of it as a community. These terms, a lot of people like these days are using community of practice around certain challenges. Like as Alicia mentioned, this might vary, who needs to be there, or what kinds of data and decisions are garnered could vary from health impact to other impacts. And so, you know, the power of people might be one idea I'll put forward in terms of those kind of hubs that can bring the necessary expertise where it's needed.
Thanks, Rumi. Try to get a couple more questions in. And by the way, remember everyone that we can continue the discussion offline after the Zoom session is finished in the kind of Q&A spaces. So if you're interested, and if we don't cover your question, please continue to post them. So I'll take a question next from John Baldock. So as a municipal climate planner, I appreciated the discussion about consulting local policymakers early, but often local policymakers don't know what they need or want. Is there a way to help or prepare local policymakers to interact productively with scientists? Another great question. I think it goes right to the point of training and translation skills on all sides. Who wants to take this one? Alicia, over to you.
I'll throw myself out there because, of course, there's no good answer to this. Which, but I'll give just a little. Maybe it's a pep talk even to all of us in a lot of ways. You know, my experience along these lines is that kind of the number one thing that I have found is really useful in talking to various people about this. One is, at least at this point, there are no, and this is changing, but but in a lot of cases there are not really great structures, systemic structures in place to make these links. Okay, so the fact of the matter is that it requires, you know, one or two extremely motivated individuals who are really looking to make these connections within a municipality or a community, and that are willing to put themselves on the line in terms of being, you know, being willing to sort of ask one-on-one questions and facilitate kind of an open dialogue between these different disciplines. I think it kind of in some ways takes a very special personality in communities to be that activated and that willing to be kind of vulnerable across different disciplines. But it really is not typically the person who's the most brilliant or has the deepest knowledge, but is actually willing to sort of walk across these communities. So that's just a plug and a pep talk for people also entering into this space with courage, because it's kind of a difficult space.
Thank you, Alicia. No, it's a great pep talk. I call these people M-shaped personalities. They are expert in more than one thing. They're able to translate. They're often maybe not the deepest expert in just one area, but because they have more than one area that they can, you know, in an informed way discuss and debate, they can make connections, and they make great champions. The other thing I will add to what you said, Alicia, is we also can, as a community of scientists, meet policymakers more than halfway. We can provide training and support in advance of when, you know, the crisis hits and you need to make decisions based on data. So an example would be we can create training courses in how to interpret particular data for certain policy, kind of common policy scenarios, how to read graphs better. Some skills we can teach in advance. DAROG, for example, has run a course with our partners, the Global Partnership for Sustainable Development Data in Africa, in 20 African countries, delivering training courses to officials in ministries of statistics, ministries of health, on how to use climate and health data analysis and how to get those skills. So some training we can also definitely provide. Right, we have 5 minutes. I have my reminder flashing at me. So we haven't been able to cover all your questions. I apologize for that. But like I said, we can continue the discussion offline. Chris, I can see you've shared some documents because one member of the audience asked for them. Thank you for that. So all it remains for me to say is huge thanks to all first of all, my panelists. We had a great discussion. As I said, it's a good sign when we veer off the prepared questions. And I think it was a rich discussion about interdisciplinarity, translation between domains, health, climate, socioeconomic, between sectors, so government, private, public, academic, even between, you know, specialisms within government. How do you connect different ministries together? So I think the byword is translation, and having the skills, the ability, the energy, and the will, as Alicia said. Let's end as a pep talk, have the energy and the will to go out and meet each other halfway, translate, because that's the only way we're going to be able to answer complex questions that don't have a simple answer in just one domain. So thank you for your time. Thank you for the audience. If you want to continue the discussion, as I said, I think there are facilities within the platform we're on. Also, I'll drop a line about Datadog's platform where you can connect with us if you're interested. As I said, I'm working with all of these great people on my panel, so we can also reach out that way. But thank you again. Have a great rest of your day. My panel, thank you one more time. And I think we're done. All the best.
Thank you very much.
Further.
Thanks, Danielle. Thanks, everyone. Bye-bye.